So let's move on to Dr. Asif Imam. So in our mixed health system, NGOs and CSOs have been filling up a major gap in the primary healthcare service provision. You, sir, have been the pioneer of utilizing an NGO platform for delivering quality primary healthcare services through the SINA initiative. What are the challenges and the successes for CSOs and NGOs to deliver universal healthcare in Pakistan at national as well as provincial level? Or what innovations or intersectoral collaborations are needed to engage the NGO sectors to achieve these SDGs? And what is the public policy vacuum in engaging the private sector for UHC and primary healthcare?
Thank you very much. My name is Asif Imam, and although I'm an allergy immunology specialist, but my passion is primary healthcare. And actually, I moved from the US to set up a robust system of primary healthcare. So, as we all know, WHO says that 80 to 90% of healthcare needs can be met at the primary healthcare level. And if you look at Pakistan, we're just the opposite. We don't have any primary healthcare system at all. That's where the fundamental problem is. And this is what we need to address, that our foundation is actually not good. We don't have a good primary healthcare. The good news is that PMDC's new leadership, they have actually sort of revolutionized the thought process of what a good primary healthcare system should be. And they are now totally focused on primary healthcare. The leadership has understood that primary healthcare ke baghair kuch nahi hoga. So right now, PMDC is trying to revamp the curriculum in which the training of the graduates, postgraduates, because there was no primary healthcare training post-medical school. Everyone was training in the hospitals. And obviously, as you know, hospital training and the primary healthcare training is very, very different. So now what they're doing is they are mandating each medical college not to just open a hospital, but 5 primary healthcare centers for training of the students and residents. So this is revolutionary. So the trend and the intellectual process has already started. But the problem is that is the first step. So you have to change the curriculum, emphasize on primary healthcare, which will cater to 80 to 90% of healthcare needs in Pakistan. If you look at any effective healthcare system like NHS or the Canadian system, they have a very robust primary healthcare system. And this is where we need to focus and develop. So the SINA story starts in 1998 when I came back from the US and started to understand the primary healthcare system in Pakistan. And obviously it was very obvious that we need to develop a whole system, not just do things in silos, complete system. And we presented our model to the WHO EMRO region in August 2023 as a care model of a primary healthcare. And it was well received over there. And since actually before we presented it, WHO has actually come up with 10 levers, operation levers of how a primary healthcare system should work. So what we have done is we have taken that 10 levers and we have developed our systems according to that. And I think we, out of 10, 9 of us, we can actually claim that we are doing that. So I think the first thing is you need a very robust model or a system with training. The doctors are trained in that system. The second challenge was you can have a nice infrastructure, a nice clinic, and the nurses, but the nurses and the doctors are not trained for primary healthcare. So we have to revamp the training as well. And this is a very big task. This is something that I think our PMDCs starting to do, but I think even the medical colleges and the residency programs should start doing. So the system is number one. Second is training of the multidisciplinary approach. Like we all said that our system is doctor driven. It has to be multidisciplinary driven. The doctor cannot do everything. They need a support team to support and provide the proper care to the patient. So training ke baad, basically it comes on implementation of that system with accountability. So हमारे वहाँ ये होता है कि आप डॉक्टर को आपने या नर्स को आपने एम्प्लॉय कर लिया एंड देन कोई पूछता नहीं है कि उसका परफॉर्मेंस कैसी है. So this is something, accountability has to come. Until accountability comes, don't expect any kind of quality of care. So we have worked on that in our system also. We have started with the audits of the doctor performance, and we have a very robust quality performance audit system for the doctors, and we re-educate them if they have any shortcomings. We train them. That's the third thing. The other thing is, this is age of digitization. We need a very robust 360-degree digital platform which will integrate all kinds of care. So we are in the process of developing a multidisciplinary digital platform, especially for primary healthcare, in which the doctor, the nurse, the nutritionist, the physiotherapist, the social worker, the pharmacist will have their own domains in which they can put their documentation of what kind of care they gave to the patient. So we have to move on to the modern technologies. And once we have done that, then we should work together, and then we come up with a national standard, like NHS. See, NHS is a national standard. We should work together, all the academic institutions and the NGOs and the private sector. They should come up with a national standard of primary healthcare, and then things are going to start happening. So that's my 2 bit.
Thank you so much, Dr. Asif.